name's Mariella. I'm going to be your nurse for today. Before we begin, can you tell me your name and date of birth?
Anthony Castano, March 8th, 1999.
Okay, and you like to go by Alex?
Yes.
Okay, and I have down here that the best way for you to learn is just by listening and then reading. Is that correct? Okay. So I am here because you were recently diagnosed with hypothyroidism during this hospital stay, and you're going to be going home, and so the doctor wants me to just go a little bit more into detail what hypothyroidism is, what signs and symptoms, what causes it, and then the medication you're going to be on to treat this. So here's this pamphlet I made for you to take home so that you can look at it at home, and then we'll go over it here as well. So the first thing we'll go over is what is hypothyroidism. So hypothyroidism, it's one of the most common endocrine disorders. It's when an individual doesn't have enough thyroid hormones, and those hormones, it's T4 and T3, and these are important because they play a role in the body's metabolism. They help with the body's temperature and growth development. So hypothyroidism is an autoimmune disease. Basically what happens is your immune system produces antibodies that attack your thyroid gland. Therefore, your thyroid hormones, there's not enough in there. So what can cause hypothyroidism? Some studies show that genetics can cause hypothyroidism, but one of the most common causes is this Hashimoto's disease. Another cause can be when you're not consuming enough iodine. That's why, like, if you look at some of the salts, like table salts, that say like iodine included. Another one is impaired pituitary hormone, or if you are taking any anti-thyroid medications. This disorder often affects women more than men, but there's also been some more studies that shown you have a greater chance of getting this disease if you have a Downs or Turner syndrome. So now that we've been through what is hypothyroidism and what can cause it, can you tell me a little bit about what it is and what causes it?
It's endocrine disorder. This is one of the most common ones. It's when an individual has deficiency in his thyroid hormones. Mm-hmm. And what causes it would be, it's mostly been linked to genetics causing it, and then we also have Hashimoto's disease, which is the most common one.
Mm-hmm. Okay, good. So now we'll go over signs and symptoms of hypothyroidism. So one of the main signs and symptoms for this is a person, they're not going to have energy, they're going to be very fatigued. They're also going to have weight gain. Their hair is going to be very thin, brittle. They're going to feel, sometimes they can feel depressed. Everything is basically going to slow down. So your heart rate will slow down, your GI, your intestines are going to slow down, so you're going to be constipated. You're going to have swelling of the skin, and then joint and muscle pain. And then how we diagnose this is, well, first you'd come in with, we'll check to see what symptoms you're experiencing and if those correlate with hypothyroidism. But another thing is we look at your labs, your thyroid labs. So your T4 and T3 are gonna be low, and your TSH are gonna be high. So now that we've been over this, can you tell me three signs and symptoms that can occur in hypothyroidism?
First is going to be weight gain. We have thinning or brittle hair, and swelling of skin.
And then there's a complication that can occur with this. It's myxomicoma. Basically, this is the exact thing as hypothyroidism. It's just your levels, your thyroid hormone levels are going to be like very severely low. And the symptoms for this, and it's important for you to look out for the symptoms, it's basically the exact same thing. It's just going to be a lot more severe. Sometimes this occurs when there's like when you have an illness such like a respiratory disease or like a UTI, or a stressful event occurs such as like a heart attack, you're not following your medication, or your thyroid gets taken out. And how we treat this complication, you either want to call 911 or go to your nearest ER, because this is a very serious complication. There you'll get IV fluids, you'll get your thyroid hormone replacement, but through your IV instead of medication. And then we'll check your blood sugar levels. If they're really low, you may need IV glucose as well. And then we'll have to monitor your heart rate, and then your blood pressure. So how do we treat hypothyroidism? And this is very important because this is what you're going to be doing at home. So hypothyroidism is only treated with a lifetime hormone replacement medication, and that medication is called Synthroid, or the brand name. So Synthroid is a synthetic form of your thyroid hormone T4, and it helps increase the metabolic rate in your body. It also helps with like cardiac output and your renal perfusion, your blood pressure, and then if you're young, it would help with your growth process. But I think you are done growing now. So some side effects that you can expect from this is your heart rate will be a little bit increased. You may get some GI upset, and then insomnia and headache. So because you can get an insomnia, we suggest that you take it every morning, and then you want to take it on an empty stomach about 30 minutes before you eat breakfast. Another thing is you don't want to take this medication within 4 hours of any multivitamins, GI medication, or simethicone, which I don't think you are any on that. You don't want to stop taking this medication at all. Like, you want to speak to your doctor before you stop taking this. Otherwise, it can cause that complication that we talked about. We'll need to schedule you for a follow-up appointment because we'll have to monitor your thyroid hormone levels to see if the dose that we're giving you is working, or if we need to increase the dose. So, can you tell me what your medication, what does it do? Or how long do you have to be on it?
It's a lifetime medication.
Yes, and then how often will you take it?
Every morning before breakfast on an empty stomach.
Yep. All right, I think that completes our teaching for the day. Is there any questions that I can answer for you?
Nope, none that I have.
All right, I'll give you this to take home.
All right.
Thank you.